Welcome back to the Dr. Geo Prostate Podcast. What if the biggest obstacle to sex after prostate cancer isn't the surgery, but your smartphone? Most men think it's mechanical, blood flow, and equipment. But we're in a global sex recession, where digital tech is rewiring arousal and fueling anxiety and isolation, especially after treatment. Today, we're joined by Dr. Marianne Brandon, renowned psychologist, certified sex therapist, and co-host of The Sex Doctors. She's here to help you reclaim intimacy, reset your arousal template, use the lingerie and music strategy to calm anxiety, and navigate orgasms after prostatectomy, including simple ways to handle bladder leaks during climax without killing the mood. Let's get into it.
Before I proceed, I just want to clarify that this podcast and all Dr. Geo content is separate from my faculty position at NYU Langone Health. The views and opinions on this podcast are my own. Our guests and sponsors are curated by me and not affiliated with NYU Langone Health. Sponsors are a way for us to provide high quality information at no cost to you so that you can take better charge of your prostate health, testosterone, and erectile function, and also how to live better with age. Welcome to the Dr. Geo Prostate Podcast. I am Dr. Geo, and it is my pleasure to talk about a very important topic around sexuality with Dr. Marianne Brandon. Marianne, thank you so much for being on.
Oh, I'm delighted to be here.
So notice how I did not even mention the wife of Dr. Abe Morgentaler, because you are your own thing. And my wife hates when people, oh, that's Dr. Geo's wife, right? But I didn't say that. I
kind of like being associated as Dr. Morgentaler's wife.
Well, thank you so much. You listening, you know who Dr. Abe Morgentaler is, so you should, because you got to look at the previous episode that is published on all things testosterone, particularly as it relates to prostate cancer. And you know that Dr. Morgentaler is the thought leader for decades around the topic. Mm-hmm. Today, I'm talking to his wife, who is a sex therapist, among many things. She's a psychologist around this. And so, Marianne, like I told my previous guest that I was interviewing, I don't really prepare. I want to have coffee with you. We're in a coffee shop and talking, and everybody's eavesdropping. I've been doing the work I do for over 20 years. So there's already have things that I'm listening to patients, and so we're just gonna roll and see where this goes. But I think we're gonna have some really good things for the audience. Let's start with this. What's happening with sexuality globally?
Wow. I would say to you that sex is going through a more dramatic transformation globally than ever before. And it's not just sex. So let's put it in context. Our worlds are changing more dramatically and quicker than they ever have in the history of humanity because of technology. So all aspects of our lives are impacted, and intimacy is absolutely one of those pieces. I think it's probably less obvious to people because it's not often discussed.
Yes, so I'm reading things. Japan, high percentage of people in their 30s, a steep decline in sex and having intercourse. That's Japan, but that's happening globally. I've seen young men that are having erectile dysfunction at 25 years old.
Mm-hmm. We should talk about that, but yeah.
We can take it there for sure. I have some theories, but I want to hear more from you. But I know that men are questioning what masculinity is, and I'm sure we could talk about that as well. That's part of the issue. The Me Too movement was a very good thing, I think, for women who are being abused. There's a pendulum here, and some men are like, whoa, let me be ultra, let me not even say hi to that girl if they're heterosexual, because I don't know if I'm going to be caught here. Should we have a drink? Not have a drink? She's coming to my room. Should I have sign a document that says, which obviously interferes with the smoothness of the process?
Absolutely.
Take it away. What are your thoughts?
Oh my goodness. Men are put in such a difficult situation today, particularly young men, as you say, who are dating. They get mixed messages, and there's it's impossible to mesh them. So on the one hand, they're supposed to be very the words I'm finding aren't appropriate, but they're not supposed to be aggressive.
Masculine is okay. Right?
Yeah.
I mean, most people understand. I know that, well, I could be, there's a whole thing, but we all have an idea what masculinity
Okay.
should look like or something, right?
So they're supposed to step away from that, but they're still supposed to ask women out, and they're supposed to be masculine in the bedroom. So it's sort of like you're supposed to turn it on and turn it off. And it's so confusing for guys that many of them are just sort of stepping out of it. And that's where I have to say AI is ready to receive them. So there's so much new sex tech out there that is easily available. And this is a trend that I worry about. Guys are having less sex. Everyone's having less sex. People are dating less. They're getting married later. So we're just seeing these trends in a variety of ways intimately. But AI is waiting in the wings and ready to satisfy anyone. So I see this as potentially really very challenging for, I'll say, humanity, because that's what I think.
Agree. Let me get out of, so what I try to do clinically in my research and my podcast is leave aside my biases and have as much as possible of an objective conversation. In fact, when I talk about how exercise is good, I will Google more like how exercise is not good. How can it increase the risk of mortality? Like I want to know the opposite.
Yeah.
Right? Why is that a problem? Why is the fact that, so one can make the argument, of course, well, there's less humanity, less babies being conceived and born. Okay, that's definitely, we can see that. Why else? Why is sexuality, and also I see the full spectrum of men, right? So I see younger men who are having sex problems. See older men, 50s, 60s, 70s, after prostatectomy, they have no sexual contact. And some of them are not unhappy. Right. Some of them are like, no, I have my wife. Well, we don't need that. We do other things to keep ourselves happy. And intimacy for me means this, not that. So why is it a problem?
So that's a really great question. And I think that it depends on what you find of value to humanity and what intimacy means to you. So we all would answer that a little differently. And there are very clear benefits to this advancing technology in terms of increasing sexual satisfaction for folks and having relationship, emotional connections with this AI that they don't already have. This is very real. But it's also, I guess I would say to you, my biggest concern is young people are getting exposure to this AI really very often before they have any human flirting or contact at all. And there is such a thing as an arousal template, meaning early on in human development, when people they have their early experiences of sexual feelings, those can be paired with whatever's going on in the environment, whether you like it or not, actually. And what happens with that arousal template is for many people, I'm not speaking for everyone, but for many people, they're kind of difficult to shift. So they kind of get imprinted in a certain way sexually, such that as a person ages, there's some element of that early template that still needs to be tapped often.
So the body keeps the score?
Yeah, I think that's a fair way
Kinda.
to say it. So to me, the issue really here is allowing younger people the opportunity to have access to humans before they have access to AI, so that when they're adults, they can make a conscious choice about what they want for themselves. And I don't know that we're setting young people up that way right now. And that's my worry.
So it sounds like you're going to be happy with the fact that I asked my 13-year-old son if he's watching porn, and if so, how much?
Absolutely, because 13 is the average age of first exposure. And whether or not he's trying to see more porn, he will see more porn. I mean, it's just a part of life. And a lot of this porn is pretty aggressive. That's really the truth.
You mean through Pornhub, or is there some other like things that are not actually showing intercourse? I mean, you're saying, when you say porn, you say pornography literally as we know it.
Exactly. And not just through things like Pornhub. That's the most popular English-speaking porn site in the world. But younger people in particular, so like age 25 and younger, the porn they're watching is anime. So anime is cartoon, which doesn't sound bad, except it's extreme. So because cartoons can look in ways that humans can't and behave in ways that humans can't, what young people are watching really to masturbate to is this exaggerated cartoon porn. And I think that we're just really part of a massive experiment, how that's going to unfold for these kids as they age. Now, I'm sure it's going to have more impact on some kids than others. Like, in no way does this technology impact us all the same. But how many kids are going to like grow up kind of needing that level of fantasy in order to feel excited? We simply don't know. So that's my worry as a psychologist working with people who struggle sexually as adults. It can be very isolating if what turns you on doesn't turn on your partner or doesn't turn on most partners. Right? So this is my concern.
From a male perspective, and I know there's a female perspective that actually maybe we could talk about a little bit. From a male perspective, I'm really focused on, it's just the nature of my work. I also have a son. My daughters are grown and we talk, but I think they're fine. I hope they're fine. You never really know. But I'm raising this 13-year-old, right? And to me, it's like back to basics. It's like, hey, it's reps. Get those reps in. Go ask the girl out, right? You will get turned down. Go through that. Getting turned down is not bad. It is good, right? You get to, oh, that didn't work. Or maybe I'll say this, or maybe I'll do that. And it's a wonderful exercise. My suspicion is that these younger kids and men are just not doing that. Is that right? I mean, what?
I think absolutely that's right. And I have to say, I love that you're setting that expectation for him, that it's normal to be turned down and not a bad thing. It's a learning experience. So that is like so awesome that you're saying that to him. But yes, younger people are, you touched on it earlier. They're getting messages that they shouldn't be aggressive. They shouldn't be masculine. Why would they set themselves up to be turned down? So they just pull back. Absolutely true.
Are they being more feminized, you think?
I do think so. And in a certain way, women are more masculinized, and there's less of that distinction, which in many ways I think is progress in terms of equal everything. But in the bedroom, there's something to be said for the distinction between vulnerability and assertiveness.
Is it healthy? And do women actually want to be more of the masculine type in a relationship and the man to be the more feminine type? Is that healthy? And do women actually want that? I mean, I know they can say sometimes, I could die, I need my rights. But deep inside, do they actually believe that and want that?
So I don't think it's a happy place for women. Women do want, I mean, we're opinionated and we're clear about what we want. And so there's a certain ease when your partner just sort of says, okay. But ultimately what happens in those relationships, I think very often, is she loses respect for him because she knows he's being a pushover and he has no spine really. Now he's just trying to accommodate, and he's just trying to have a sex life. Because the feedback he's getting is, if you play by my rules, I'm going to be happy. This is unconscious.
And if I'm happy, I'll have sex with you.
Right. He's just trying to read the room. But I don't think, so much of what drives us sexually is unconscious. So I think what women have lost is an understanding that if that's the relationship she creates, she might like it from 9 to 5, but she's not going to want to have sex with someone that she doesn't respect.
All right. We're going to head into men after prostatectomy in a minute or so. But what do you find that is the solution here? What do we do? What do we do? What do parents do? Because here's the thing. My audience is not the 25-year-old. These are not the ones that are listening to this podcast. They're the 50, 60, 70-year-olds. They have kids that are in their 20s and 20s. And some of them have grandchildren that are in their 20s. What do we do? If the kid were to listen, if the 25-year-old is actually listening, what does he do on his own? Or what can I tell my 25-year-old son? Hey, buddy, look, we need to, I don't know, get off the video games, stop ordering or, Uber Eats, and actually get up and go get it and move more and get to me, it's like get in the gym. I think it's very important for all of us, but certainly for young men, get in the gym.
Right.
and get off, if it feels too good, get off. That's not good. Like a bag of cookies is too good, right? Don't do it, right? What can men who have kids that are millennials or Gen Zs do? And what if the kids are actually listening, what can they do?
So I love all of the advice you just said. Love it. What if I had a young man, what I would encourage him to do is spend time with other men, get involved in sports, and like you said, go to the gym, try even things like Tai Chi, things that get you in your body and help you feel your power, basically. So feel your power in your body, and that's, I think, going to carry you through. So you have to have a balance. AI is a part of the world and can be very beneficial to us. This isn't about removing AI from your life at all. It's about maintaining a balance, which includes connection to your body, which I think is very largely people are losing now because we're all up here thinking and playing on our phones. So that embodiment is, I think, what's being lost. And if men and boys can be encouraged to find that power, I think they'll be able to manage all of this as they age.
Do they need to find their masculine power more specifically? And what does that really mean? I mean, look, I am trying to raise my son to be a good man.
Yeah.
But I have to say, is my definition of a good man. And what if I have it wrong? I don't think I do, but who knows? I mean, what if I have it wrong, right? But I have this vision of what that looks like. And everything I do with him is so that to get him as close as possible to what that looks like in my head.
Yeah.
What if I have it wrong?
Well, what an interesting thing to say. And I guess my response to that would be, he does need a starting point. And you can say, I might have it wrong for you, but see how this resonates and think about this. That's what I would say to you, because he does need a starting point. And young women do too. So we've been very focused on teaching girls and young women to be fierce at a loss of their comfort with vulnerability. And most women need to be able to feel vulnerable sexually in order to enjoy themselves. So fierce is tight, right? But sex from here can be fun sometimes. But for most women to feel satisfied in a deeper way, they have to be able to let go. That's vulnerable. They have to
Loosen
get out
up. And actually, that's when they'll enjoy the process as well. That's why you have a lot of women. There's many reasons why there's a lot of dissatisfaction with sex, but that's probably one of the reasons. It's just too tight.
Right. Too tight. When you talk to them about vulnerability, they have just a very negative association to that. They think that's associated with, being available for sexual abuse, and it is, but in a different context.
1 out of 3 probably has been sexual. I remember even some statistic, like a high amount of women have been at some point or another sexually abused in one way or another.
Right. If you include verbal abuse, those numbers are high for men too. So, but yes, so women absolutely have to protect themselves around that and be aware. Absolutely. But if she's going to enjoy orgasm and all of this, she's going to have to
let go.
Right.
Love that. So definitely in that area, we can go on for several hours. I think I want to segue, if that's okay, with because a lot of the men that are listening have had either prostate cancer or have it or will have it, or they want to figure this out. And there's not enough good talk around sexuality after prostate cancer treatment.
Absolutely.
So I spoke to your amazing husband around testosterone. And I think that we won't touch that much because we spoke about it. And so I'm going to refer people to that episode with Dr. Abe Morgenthaler in terms of the importance and the myths around testosterone and prostate cancer. But the takeaway there, and I do want you all to go check out that episode, is that optimal testosterone is always better going into a treatment. And even after treatment, you want optimal testosterone is not associated with progression or even development of prostate cancer. That's the quick takeaway. But the more details there. What can man? So let's say they have a prostatectomy. Well, there's different situations. Sometimes you have guys on active surveillance, no treatment, and they don't function, and it has nothing to do with the cancer. It has to do with something else and many other issues that we've talked about. But
Mhm.
sometimes they have treatment, and that treatment, if it's prostatectomy, is one thing. If it's just radiation and hormone therapy is another. More advanced cases is hormone therapy. So let's just say I've seen men after prostatectomy, let's say, that they taught me is, oh, we're intimate. Oh, really? Wow. So you're getting an erection already? Oh, no, I don't get erections. What do you mean? Well, we play. So we play, we make love, we find other ways, and she orgasms and so do I, but I don't have into. So I'm learning. So take us through a process of some sort. I'll let you take it away and the
Okay.
floor will be yours. Is like, what do they do? What's the psychology? How do they approach this after prostate cancer treatment?
So there are so many, I agree with you, so many places to go here. I would suspect that those men that you're learning from are rare. And I say that the men that are telling you that they've learned how to maintain an intimate relationship after their surgery or radiation, I say that because even in couples, and I'm talking long-term relationships, but even in couples who aren't struggling with these kinds of issues, sexual communication is poor. 25% of marriages are sexless. Isn't that something?
Wow.
In a
We're not
in
talking sex every month, which is, I think, is too little, but maybe that's my opinion. We're talking about no sex,
yeah, that's
25%.
right, right.
Okay.
Or 3 times a year, like very little
Wow.
sex. That's a significant number of the population right there. That's a non-clinical sample. They haven't had surgery or any issue. And in a non-clinical sample as well, about 30% of men will report a sexual concern or dysfunction in the past year. Non-clinical sample. So challenges are so common. 40% of women will report a sexual concern or dysfunction in the past year. So it's hard. I think those are
Cancer
rare.
aside, again, what we were talking about before is a huge issue going on across the full spectrum of age and phases of one's life.
Exactly. And so now on top of it, these men are dealing with whatever kinds of treatment side effects. I would say it's common when people are dealing with a cancer diagnosis to be depressed. That's not uncommon. It's scary and it brings up a lot of stuff. What's life and death issues and all of that. So, one of the things I would say to men, make sure that you're not dealing with that too. And that might mean getting an evaluation, talk to your doctor about it, because depression is also going to do things like lower your libido. It's going to impact your engagement in the world, your pleasure in life, your energy level, a lot of different things, concentration. And people don't always realize they're depressed, particularly guys, because they sort of think it should look a certain way. I mean, it should mean I'm crying on the couch or I can't get out of bed. And it can look like that. But often for men, it doesn't look like that. They're still functioning, they're still doing what they need to do in the world. So I would say that's one thing that I would encourage men to consider is just double check and make sure they're not dealing with that as well. And then common symptoms that guys have to deal with after treatments are like urine leakage when they have an orgasm, erectile dysfunction, and we could talk about these. We could talk more about depression too. Those are things that are pretty common.
They're interconnected for sure. I find so my guidance with men after prostatectomy, let's say, is we got to get the urine right because if not, psychologically, you won't be able to, even if you can have an erection, you won't be able, it's not going to feel right. So you're not going to have intercourse.
Mm-hmm.
Why don't you take that away? What are your thoughts on that? And what would you do for
Mm-hmm.
urinary incontinence after a prostatectomy?
Great question. First of all, it's difficult to communicate with your partner about this stuff, but it is really important and helpful. And what I would say to men, talking about sex is challenging for everybody, and they can always ask their partner to watch this podcast with them, and that'll like break the ice about this. But suggesting to their partner that they're aware that their intimate relationship isn't what it was. She's probably shocked, assuming he's heterosexual. She's shocked. He's shocked. And just say, let's find a time to talk about this. Like, what's this been like for you? So I would say, don't jump into urine leakage. Let's just keep it like move in that direction, but start more globally. Like, do you miss touching? Because oftentimes when couples are struggling with a sexual dysfunction or urine leakage, they stop touching because they don't want to communicate, I'm ready for sex. So there's no touch happening. And that's critical because we all need touch. So I would say in a conversation, start more globally. What do you miss? What's this been like for you? And allow that conversation to naturally unfold. That might need to be multiple conversations before you move on to more specifics. But then saying, I'm afraid I'm going to leak urine. I know I'm going to leak urine. I'm concerned about what that's going to feel like to you. And it's so upsetting to me that it's preventing me from being close with you. You don't have to have a solution to have a conversation. And I think that stops people because there isn't necessarily solutions to this stuff right away. There are strategies. We could talk about that, but there aren't necessarily solutions. And so people are afraid to speak up. But
I think the guy is embarrassed to have that conversation with his wife. So that would be a hurdle to overcome. I know that I'm not a prostate cancer survivor or anything, but I'm willing to have certain vulnerable conversations with my wife, but not many, because I don't want her to think that the man, whatever you want to say, like that is weak or too weak. And wow, what do I do now? I don't want her to give her that concern. And also, I'm also embarrassed. I would be embarrassed to have too many vulnerable conversations with my wife. So I can assume that's part of the issue.
And that makes a lot of sense. I get that.
How can a woman get signals that, there's probably, he wants to talk about it, but he's embarrassed to talk about it? And how can they ease that into that conversation or help the man open up a little bit more? Is there a way?
So signals is, I think, challenging just because some people don't give out any signals and some people do. So I don't know that I would encourage people to look for certain things. But she could say, again, I would say start globally and allow the conversation to naturally get more specific. And in that way, you could feel out, how's it feeling to have this conversation? How's it going over with my partner? Am I feeling disempowered by this or closer? Because what can happen is when people talk about difficult things, they can actually feel closer and more intimate. That's a reality, because one of the things about passion is it's correlated with risk and vulnerability. It's really interesting. If you think back to like the best sex you've had in your life.
We just had a fight. Right after a fight. They call it makeup sex, right? Wow, that was fight more often, sweetheart.
Yeah. Okay, so that's a good point. But outside of makeup sex, when you've got that like rush, it's probably like a new partner doing something new. That's all risk. Okay. And that correlates with passion. So it's risky to have these conversations, and not everyone is going to feel like they get that benefit, but some people will. Some people will, even if there's no solution, like I said. So I think, what we're talking about is how she can initiate this conversation.
Yeah, how can she ease up that process? And just to be clear for the audience, right, who's listening, you're there somewhere like, man, this is me. It only matters if at least one party is really interested in having that level of intimacy. I think that is perfectly healthy.
Yeah.
I mean, correct me if I'm wrong, Marianne. If both parties are like, no, that's not we love each other in many other ways, but that type of intimacy is not important for us. So you're good. You don't have to worry. You don't even have to listen. You can stop listening right now. Right?
That's a great point. Absolutely true. Yes.
Yeah. So we're talking about if one party out of the two is really, or let me just say, if both parties are interested in, after a prostatectomy or prostate cancer treatment, the man cannot get an erection. That's and how do we help this process go along so that you can go back to some level of intimacy? So what can a woman do to, I believe in my experience, so I've done sexual consultations after prostatectomy, Marianne, to help the man more often with either pelvic exercise, some supplements, a little Cialis, whatever. And I've noticed that, and I talked to their, in most cases, female spouses. And I said, look, you play a role here. I said, look, I don't want to put this pressure on you that if it's not, but you do play a big role here because at the end, you guys want to be relaxed and enjoy that process and sort of see where it goes.
Mm-hmm.
If he doesn't get an erection, is fine. If he does, great. But just kind of play. Have a glass of wine and play, and then you ease him up. And if he's just like you were talking about before with females, the same thing with men. If they're tense and worried, oh my God, would I be able to? Oh my God, I don't know if I will. Okay, I'm going to go try. Then they're not. That's not happening. That's sympathetic mode. That's it. You're done, right?
Yeah,
Is that good, or was there another way?
So I love that advice. I would say to her, being loving is the most critical piece of the puzzle in that conversation. So make sure that your heart's open, that it doesn't. Now, you can't really control if it's going to come across as critical, but you certainly can put out love. So you can rub your partner's back, or, just sort of very gently say, if this is valid for her, I miss our closeness. It doesn't mean that closeness could come in so many forms. And I miss our touching and feeling connected to you in that way. It's okay if we just forego attempts at intercourse altogether, but I really would love to do things like lay naked with you again or slow dance. And if she lays out the expectation right away, I think that is probably going to be helpful for him. So he knows at least that's not pressure from her. He'll still have pressure from himself.
Yeah.
He'll still put it on himself. But
Hopefully
at least
not too much. It's just too stressful, and then nothing will work, right? Hopefully is enough pressure that he's interested and wants to, but kind of eases it off with whatever,
Right. I tell men, couples, expect things to go wrong because, first of all, they go wrong for everybody. So we can't control our bodies. Nobody can. But they're going to more likely go wrong in these situations, particularly as you're reconnecting sexually. You are going to be anxious. That's going to be a part of it. So I encourage couples to think through how they're going to handle it. Like when he does urinate, when he has an orgasm, how are you going to handle it? If he can't get an erection, how are you going to handle it? And there are lovely ways to handle these things, like lay together, hold each other, massage each other.
And there's some nice essential oils that bring some aroma, get things, rose oil and things of the sort, essential oils. So man gets a prostatectomy, and he does have at least one set of nerves, so he probably can get an erection after a prostatectomy. Assuming that so I always say to men, look, if your erections are not at least 7 out of 10 before surgery, it's not going to get better after. So you need to not have diabetes and, not have erectile dysfunction, not be less than a 7 out of 10. But if you do, there's a good chance. How can we help men get erections so that they can enjoy intercourse? And that's part of the intimacy after prostate cancer treatment.
So one of the things I encourage men to look into are more modern sex toys for men. Because, there are
sex toys. All right.
So you can even go on Amazon.com and find sex toys, for example, that fit on the base of your penis and vibrate. And so they offer amped up stimulation for actually both partners, depending on how you place it. But what he's really looking to do is amp up stimulation to the degree that he can, and that can help. Sometimes men feel comfortable, not always, but watching porn before they meet up with their partner. So they kind of get
positive to porn. We tend to, knock on porn as but there is a positive.
Absolutely.
Okay.
Absolutely. Right. So it's kind of like he can have a little foreplay for himself and start to amp up and his desire, and that can be helpful. These are the things he can be thinking about. What they could do sexually that would make sex more exciting. Maybe eye contact. Maybe if his partner said certain things to him. Maybe if his partner wore lingerie. There are things that can make sex more stimulating, and I would ask him to think about that and talk to his partner about it. And honestly, if it's too difficult to have those conversations, you can ask a therapist. You can find a sex therapist who can help with those conversations.
Is there a good website to find sex therapists
Yeah.
that is like with a list of names?
There
All
are
right.
two. So one of them is ASECT. It's AASECT.org. It's the American Association of Sex Educators, Counselors, and Therapists. The other one is starnet.org, SSTARNET.org, and that's the Society for Sex Therapy and Research. Both of those websites will give you the opportunity to look geographically for therapists near you. The impressive thing about STAR is that in order to become a member of STAR, you have to have had a certain amount of therapy yourself. So these are experienced therapists. And so I think that's worth something.
Great. Thanks for that. Thank you. So I've had some men who are, is there anything else you want to say with men after prostatectomy and getting sexually active and getting with erections? Is there anything else?
Constriction rings, I think that is helpful for many men. So those are like silicone rings that I would encourage them to talk to their doctor about it before using them, but you can get them in gradated sizes. And after you get an erection, you can put on a silicone ring, and that can help you maintain the blood flow in your penis or prevent it from leaking. And I understand that those silicone rings can also be used to kind of constrict your urethra. Does that feel right to you? Or is that something you would say to your patients?
Yeah. Yes.
Yeah. Okay.
Yes.
So you can use a constriction ring if you're afraid of urinating during
Yeah.
orgasm, and it could at least slow the process down, right? Of urination.
The only complaint with that, not that for some anyway, is the spontaneity. Like, oh wait, I need to let me. Okay, good, put it on.
Right.
So yeah.
So I would say you can use, just like you could bring a condom into the experience and make it part of foreplay. You can do that with constriction rings too. Just make it a part of touching.
Make it work.
Yeah.
Make it work. Lovely. Thank you so much for that. Guys who are on ADT, so it's interesting. Many guys, so you would think they're on androgen deprivation therapy, and there's no way they have interest. Some don't, some lose interest, but some do. And I think some will it because it's like, I'm a man, this is what I should do anyway. Any thoughts on what they can do? What's happening there? Because I am surprised when they are on ADT. I have a guy who's on ADT. He's like, yeah, I have sex frequently with my wife. I was like, whoa, why? You're like the poster child for this.
Yeah.
Any idea what's happening there? Nor I didn't ask Abe Morgenthaler, well, how can people be interested in sex with no testosterone? But any idea what's going on there? Is it the power of estrogen? Because I know estrogen stays the same, and estrogen is actually important for libido in men. Actually, happening there that I should know about.
Well, I'd be inclined to say, sex meets a variety of our needs, and there are different impulses that motivate us for sex, and it's not just hormones.
Oh.
So some men are still, turned on by stuff like whatever it is, even without the testosterone support. It could be the connection. It could be they find their partner so sexy and they like
for some of them is they're newly married to kind of a much younger wife, and they still find her hot, is what they would say. Right. My wife is hot.
Yeah.
Interesting. So I would think hotness comes with level of testosterone, not just with how someone looks. I learn a lot from patients, honestly, Marianne. I think that, there's this old saying, who teaches, what's the saying? Who teaches patients doctors? Who teaches doctors patients?
I love that.
And it's true. And it's true. I think you wanted to talk, I think you can talk around urinary incontinence and how to improve on that. Any ideas other than the constriction rings that you spoke about, or is there anything else?
I would say wear condoms. That might be helpful. Make sure you urinate before sex. You might want to limit your fluid intake for a few hours before.
Right.
That can be helpful.
Okay. Now.
Oh, can I say one more thing about that?
Please. Yeah.
Keep in mind that if you've watched porn at all in the last decade or two, one of the favorite things men watch on porn is a woman urinating when she climaxes. Like, that's a big thing.
Wait a minute. Women urinating on the man?
When she gets so excited, she can't not, and then it's basically leaking urine.
Right.
But many men find that really exciting. Now,
Is the other way
So
around?
it's not, but I think it's important to recognize, like, this is one of the ways that sex is sexist against men. Helpful to remember that it's not inherently disliked. Some people actually find that really exciting. Not to set him up to expect his partner to respond that way, but just to remember, like, this is one of the ways that sex is more challenging for men.
Any ideas? And I really don't want to, this is not that kind of podcast, and I really don't want to get overly graphic, but any ideas or thoughts around oral sex in men after prostatectomy? Certainly from the males, the man who had the prostatectomy. Efficacy, that helps. That really helps. It should, if they're open to it, they should try. Any idea around that?
Well, I think that that's something that many people enjoy, either receiving and or giving after prostatectomy. And it's exciting for potentially both partners. And it's a wonderful thing to experiment with. And he doesn't need an erection to enjoy it.
Right, correct. That's right. In fact, they can climax. That's the other thing they taught me. They climax, and the experience is intense, is my understanding. The orgasmic experience is intense relative to before they had their prostate removed.
Right. So it's going to be a matter of communicating, because he'll need different stimulation if he's not erect. He'll need a different kind of touch, and he may enjoy things differently than he used to. Just having a conversation about that, which may be obvious, but
The
may not
common
be.
theme here, Marianne, is communication.
It is.
Isn't that hard?
It's hard.
Right? So if you didn't have that before the surgery, what are the chances of you're going to start up better communication after you had the treatment? Isn't that right, or no?
Yeah, you can do it, but you've got to know that it's going to make you anxious. But the benefits outweigh, I would say, the anxiety.
Assuming that both parties, or at least one party, is really interested, and the other one is somewhat, it needs to have some level of interest. If you're not interested, again, no worries. But if you are, it's worth trying.
Yeah.
And so one of these organizations, AASACT.org or StartNet with 2 S's.org, I would want to find, and a lot of my patients sometimes ask, who can I talk to? A good sex therapist that can talk to both of them around it. And at least if it's not around, because they probably won't help as much with the actual erections, but with the communication around sexuality, right?
Absolutely. I think that's a fabulous step to take. And you might want to ask when you call a sex therapist, have you worked with men who have these issues? Because actually not all sex therapists have.
Right.
So it will be helpful if they have had experience with these challenges. Maybe they'd be more comfortable talking to a man, maybe a woman. So people have different feelings about that, but you can shop around a little bit till you find the right fit.
I think so. I will develop, with perhaps some contacts that you have and other people in the space, develop a list of names, actually. I think that'll be good for people and have it available. Look, I think, and if the woman is listening, because my understanding is that a lot of our listeners outside of YouTube is actually females. We're trying to figure that out, but I think it's women that have men that they actually love, whether it's their father, their husbands, or their sons or brothers. Yeah. And so if it's women listening, I think it's just very important if it's something of interest. And look, my bias is, and I'll say my bias, sexuality is a strong point of connection. It's very important for health, right? For enjoyment of life and actual health. Different chemicals that are produced during the different phases of sexuality or during the time you're sexual. So it's important. Again, I repeat, if you're not interested, no problem. But if you are, be open to a conversation, better communication, right, Marianne?
Absolutely. It's key. It is key. And I would say to her, your needs matter. And you can get your needs met in a variety of ways with your partner present. Like your partner, if your partner isn't really open to being touched, your partner can hold you while you masturbate. I mean, there's a lot you can do to get your needs met. And your body's changing too as you age. So don't forget that piece. Talk to your gynecologist about hormones or whatever could be helpful for you too. Yeah.
That's awesome. Thank you for that. I think I don't want it to go too long. I want people to know about your podcast with the
Oh,
one and only Dr. Abe Morgenthaler. See, not the wife of Dr. Abe Morgan. This is Dr. Marianne Brandon and Dr. Abe Morgenthaler's podcast.
yeah.
My wife is gonna love that because she's like, "Oh, Dr. Gio's wife." I was like, "No, I'm Joanna Espinoza. I'm not Dr. Gio's wife." You want to talk a little bit about your podcast?
Sure. It's a lot of fun to do a podcast with Abe. So it's called The Sex Doctors. You
Mm-hmm.
can find us online at the
Mm-hmm.
sexdoctorspodcast.com, the Sex Doctors Podcast. And we talk about a whole lot of different things. We do a lot of testosterone talk,
Sure.
but we also talk about how to make love. Having sex is innate, but lovemaking is a learned skill. And
Ooh,
we
wait,
talk
you got
about
to repeat
that.
that line. You cannot just keep going. Like, I love that line.
Yeah, it's true.
Having sex is innate, but
Yeah.
making love is a skill.
Right. It's a learned skill, like anything. Like you have to practice to get better at it. And
Define making love.
it's love making, in my definition, would be using your entire body to communicate, transfer love to your partner. So that means through your eyes, through your touch, through your words. So your whole body is sort of feeling love and transmitting it. It's really just nonverbal communication in that our eyes, our face can change if we're happy or angry. We could touch things differently based on what we're feeling. It's just a matter of being conscious of that and communicating that
Would you go
when you're together.
would you go on a limb and say there's an energetic transfer as well? And I know that gets a little bit potentially mo, but
I think that's a fine way to
yeah,
explain it.
yeah.
I mean, and that could be very helpful for some people who are
For
trying
some
to
people,
understand.
yeah.
You want to use your hands and your eyes to kind of wash your partner's body in your love for them. I tell people to, before meeting up, if they're going to make love, not all sex is making love. There are different
Go
kinds of
ahead,
sex.
keep going. Now
So,
you have to expand on that. You can't leave us high and dry like that. What's the
all
difference?
right,
Yeah,
but okay,
yeah,
but we'll
go
talk
ahead,
about
go
that.
ahead.
I think that's important. But if you're going to make love, you probably want to somehow let your partner know that's the kind of sex you want to have. You don't have to, but it'll maybe go smoother. You can communicate that with the music that you put on in the bedroom. I
Mm.
mean, that'll obviously make a statement. But what you want to do, if you can, before you join your partner, is think about why you love your partner, what they've added to your life, why you feel grateful to them, maybe what their challenges are, because that can make us feel more compassionate. But you just like immerse yourself in those feelings so that they're more accessible when you join your partner. And making love is about the connection. It's not about the technique.
As you said
It
earlier, you want to be less tense and more loose, right? I found that to be that resonates, right?
Yeah,
You go in, you're tense, and you're like, you gotta will it or some. No, you gotta be loose, and both
yeah,
parties, by the way, it's both parties.
absolutely. And life closes us. Like you watch the news, you get
Every
tight.
online social media, it's
Right.
oh
Yeah.
man,
So you've got to like have. I encourage people to have like a regular practice of like letting this stuff go, whatever that is.
a good movie with a
Meditation or
good sex scene.
yeah, that's a good one.
Those. It seems like that can help. It doesn't have to be all
Yeah,
the way porn, but some sort of hot
right,
scene. I don't even
right.
have one on the top of my head, but you know what I'm talking
You
about.
you could Google it. You could say top 10 sex scenes in famous movies or something like that. And you'll get
Right.
the clips. They'll be on YouTube. You'll get the clips. So
Like
you
one
could go,
of the husband may not even have to, or the man doesn't even have to announce it. Hey, we're gonna watch a movie, sweetheart. Which one is a surprise?
yeah, that's good.
Let's just,
That's
yeah.
good. I like that. Right.
Oh man,
Set the mood.
that's great. Dr. Marianne Brandon, thanks again. The podcast is the Sex Doctors Podcast. Is that right?
That's right.
All
Yeah.
right.
Well,
Found
we're
everywhere.
yeah, found everywhere.
You were gonna say?
I was just going to say that's the website. The easiest way to get to us quickly is just to do the sexdoctorspodcast.com.
Excellent. I can't wait. I'm going to subscribe right away as well. I haven't done so already. I'm afraid to say, but I'm going to do it myself. Thank you so much. Do you have any final words, any takeaways that you want to before we part ways here?
I would say a couple of things. Intimacy is really important for our mental health and our physical health. And intimacy could look different for every single couple. And it does not require intercourse or even genital touching. It's different for everyone. And if you do something like lay together with eye contact and saying, I love you, that could feel more intimate than intercourse ever could. I think the couples that do best after treatment have expanded their view of what intimacy can be, and they'll feel the connection and realize quickly that intercourse is not required if that's their intention.
Right. Love it. Thank you so much. And thank you for being on. I really appreciate
My
it.
pleasure. It's really fun talking
Pleasure
with
to
you.
have you. Likewise. Dr. Marianne Brandon, thank you so much. And guys, thank you so much for watching, for listening, whatever platform you're using. We give you the goods here. This is all for you so that you could be more self-empowered through this process, through this difficult process, wherever you are in your prostate journey or prostate cancer journey. There's always good information out there. There's sometimes not great information out there, but there's always also good information out there. As you know, I always get the best of the best to come on, and so we can talk and so that they can share some of their wisdom and experiences and clinical experience with us. So thanks again for tuning in. I'll see you next time. Don't forget to subscribe wherever you are and to like 5 stars if you think I deserve it. I hope you do. It helps a lot with the algorithms and getting this into more hands. And the Dr. Geo newsletter on drgeo.com. This is Dr. Geo. I'm signing off. I'll talk to you next time. Much love to you all. See you next time.
Thanks for watching the Dr. Geo Prostate Podcast, where knowledge meets action for a healthier, stronger you. If you found this episode helpful, don't forget to hit like, leave us a comment, and subscribe to our channel. And if you want to take your learning even further, join our exclusive membership community at drgeo.com for access to full transcripts, curated resources, and member-only discounts. Your health journey starts with the right information, and we're here to guide you every step of the way. Until next time, stay proactive, stay strong, and live your best life.